Hey health advocates, shortness of breath, fatigue, a soft murmur that's easy to miss? It could be mitral regurgitation, a condition where blood leaks backward in the heart, straining the lungs and overloading the heart. Let's talk about what causes it, how to spot it, and the critical nursing care involved. Mitral regurgitation occurs when the mitral valve doesn't close properly during systole, allowing blood to flow backward from the left ventricle into the left atrium. Over time, this leads to volume overload, left atrial dilation, pulmonary hypertension, and eventually heart failure if not addressed. Common causes include mitral valve prolapse, rheumatic heart disease, ischemic heart disease after MI, infective endocarditis, papillary muscle dysfunction or rupture, and congenital valve abnormalities. Signs and symptoms include fatigue and weakness, dyspnea on exertion, orthopnea, palpitations or irregular heartbeat, and peripheral edema if advanced heart failure develops. The murmur is holosystolic, best heard at the apex, radiating to the axilla, high-pitched and blowing. Diagnosis includes echocardiogram as the gold standard, chest X-ray for cardiomegaly or pulmonary congestion, ECG for atrial fibrillation or LVH, and cardiac catheterization for pre-surgical planning. Treatment depends on severity and symptoms. Medical management includes diuretics for pulmonary congestion, beta blockers or ACE inhibitors for afterload reduction, and anticoagulation if atrial fibrillation is present. Surgical options include valve repair, valve replacement if repair isn't feasible, and MitraClip for high-risk surgical candidates. Nursing care priorities include monitoring vital signs, oxygenation, and lung sounds, watching for signs of fluid overload and worsening heart failure. Educate patients on daily weights, sodium restriction, medication adherence, and recognizing red flag symptoms like worsening shortness of breath, dizziness, and palpitations. Provide pre- and post-operative care for valve surgery, including bleeding precautions, rhythm monitoring, and infection prevention. Mitral regurgitation might seem subtle, but, if left untreated, it can turn deadly. Nurses are vital in detecting murmurs, managing fluid balance, and guiding patients through long-term care or surgical recovery. Have you cared for someone with valve disease? Drop your stories and tips in the comments, like, subscribe, and follow for more heart-smart nursing care.